LarySeal Blue. This video will demonstrate the correct technique for preparing and inserting the LarySeal Blue laryngeal mask airway from Flexicare. LarySeal Blue is a 100% silicone, single patient use laryngeal mask available in 7 sizes from 1 to 5. LarySeal Blue is supplied in rigid thermoform packaging which prevents LarySeal from being damaged in transit or while in storage. The LarySeal Blue packaging displays indication of LarySeal size, description, reference, lot number and use-by date, together with the maximum volume of air required to inflate the patient cuff. The simplified instructions remind unfamiliar users of the standard insertion technique. LarySeal Blue is sterile packed and has met the requirements of regulatory authorities. When you have selected the correct size LarySeal Blue laryngeal mask, you will be ready to remove it from a thermoformed packaging. First, locate the Peel Here tab. Place the tab securely between your thumb and index finger with your other hand holding the clear formed shell of the packaging. In one smooth action, pull the Tyvek cover back, applying even force to each side. LarySeal Blue can now be removed from its protective packaging. Inspection of the LarySeal Blue reveals all the essential information visible on the main tube. This allows the user to reaffirm the correct choice and insert LarySeal quickly and effectively. You will see that the LarySeal main tube clearly indicates approximate patient weight near the 15mm male patient end connector. In this instance, the indicated weight range is 30 to 50 kilograms, LarySeal size 3. The LarySeal Blue single patient use stipulation is reinforced, as is the maximum volume of air to be inserted into the patient cuff. The black line that you can see running up the center of the laryngeal mask assists in the correct placement of LarySeal. With the black indicator aligned to the septum of the nose, you can be certain that the main tube and cuff is not twisted and that an optimum seal may be achieved. LarySeal Blue features a 15mm transparent male connector. This aids quick visual inspection and allows LarySeal to be connected to a range of accessories. The LarySeal Blue main tube is curved to fit the patient's anatomy, which means a quick and effortless insertion. LarySeal Blue features a deep and open patient port. This allows for unrestricted access with a scope or other intubation aids. The symmetrical shape ensures an easier insertion with a low seal pressure which reduces the risk of patient trauma. LarySeal Blue utilizes a separate insertion line. This ensures that there is no movement of the mask which could cause leaking during inflation of the patient cuff. The inflation line and pilot balloon are also 100% silicone. The color-coded pilot balloon makes for quick assessment of LarySeal Blue size and maximum cuff volume to be used. Immediately before use, you will need to remove the valve decompression tab by holding the balloon between your thumb and index finger before using a twist and pull action to remove the tab safely. The tab can now be discarded. Preparing to insert LarySeal Blue. Before insertion, you will need to fully deflate the patient cuff. Contrary to popular belief, laryngeal mask airway should be inserted with no air in the cuff. This minimizes the risk of the epiglottis folding and obscuring the patient's airway. Deflating the patient cuff is best undertaken using the LarySeal cuff inflator. Simply locate the LarySeal cuff inflator onto the pilot balloon using a push and twist action. Pull the plunger back to withdraw the air from the cuff before removing the LarySeal cuff inflator. You will now have a perfectly symmetrical and empty patient cuff. Next, place a bolus of lubricating gel on the back plate of LarySeal Blue. Massage the gel into the back plate and around the base of the main tube, taking care not to put any gel on the inner surface. Using the jaw thrust, tilt and lift maneuver, extend the patient's head and neck. This will help align the airways for a quick and easy first time insertion. You are now ready to insert LarySeal Blue. Place your index finger behind the patient cuff between the juncture of the inflation line and the main tube and grasp the LarySeal Blue securely. Place the tip of the LarySeal Blue patient cuff just behind the patient's upper teeth against the hard palate. Massage some of the lubricating gel contained on the back of the patient cuff against the hard palate before advancing the LarySeal Blue with a definitive force into the patient's airway. Allow the patient cuff and main tube to follow the curvature of the hard and then soft palate along the pharyngeal curve until positive resistance is met. Hold the mask securely with your remaining hand and withdraw your index finger. Match the colour of the LarySeal cuff inflator to the colour of the pilot balloon and insert 1/3 of the maximum volume to seat the LarySeal blue. Some movement of the main tube is perfectly normal, and this can be taken to mean that the LarySeal is correctly placed. Adjust the cuff volume as necessary. With the inflation line exiting to the corner of the mouth, LarySeal blue can next be connected to your chosen anaesthesia accessory. On completion of the procedure, LarySeal blue may be left in situ until the patient regains consciousness and control of their airway reflexes. At this point, LarySeal blue may be safely removed by simply applying force to the main tube away from the patient's airway. Discard LarySeal blue in accordance with your local hospital policy for the safe removal of medical devices. For more information, visit flexicare.com.